Achilles tendonitis occurs in the back of the heel, and that's where the Achilles tendon ends, inserts over there, and actually the tendon is an extension of the muscle that starts in the upper thigh. Now, the problem with Achilles tendonitis, especially in an older person, say even somebody over 40 years old, is that the circulation is very poor in the Achilles tendon. And if the tendon is torn or partially torn, it's very, very hard for it to start to heal because of the poor vascular status, poor circulation in the area. Yes, you probably did aggravate it by running too much. You have to start gradually on your runs. You want to start 2 miles the first week, 3 miles, et cetera, et cetera. Increase your mileage gradually. And the most important thing that you can do is before you start running is stretch. You have to stretch. I cannot emphasize that enough. And once you stretch, then you build up your miles gradually. And after every single run, you need to ice your foot. The Achilles tendon, actually. Ice it, it's extremely important. The best way to diagnose it, of course, you want to take an x-ray first to make sure there's no bony involvement. And if there's no bony involvement, we use ultrasound now. You can go in and take an ultrasound, and you can actually see the tears, the small little micro tears in the tendon. For treating acute Achilles tendonitis is to stop exercising. You want to use rest, ice, elevation, very, very important. After that, you can use non-steroidal anti-inflammatories. You can buy over-the-counter Motrin, which is ibuprofen. You can take 1 or 2 tablets every 4 to 6 hours, and that'll decrease the pain and also help the healing. As I said previously, prolotherapy, which are injections of certain medications that actually increase the healing of the Achilles tendon. Orthotic therapy is probably the most important thing to prevent the Achilles tendon from stretching too much. And once you heal, stretching before and stretching after your run is very important, whether you're playing tennis or whatever you decide to do, whatever sport you're doing. I need to make something perfectly clear at this point. Don't ever let anybody inject a cortisone into the Achilles tendon, because that will increase the propensity for it to tear. As I said previously, stretching and the proper shoe gear, the proper running shoe, something that's flexible at the metatarsal phalangeal joints over here, and something that's supportive. The sneaker should be supportive at the counter in the back, and it should be lightweight. After a few days to a week, if you're still having pain in the Achilles tendon and it's not relieved by over-the-counter medication, it's not relieved by ice, it's not relieved by rest, then make an appointment with a podiatrist. That's extremely important, because if you ignore the problem, the small little tears in the tendon can actually, the entire tendon can tear, and then you will have to either have surgery or you will be in a cast for 6 to 8 weeks at least. So don't take it lightly. Remember, the circulation in the area is very poor, so you have to address it when you have the problem.